Welcome to Chillin' 101. We hope this video helps.
You begin by confirming stitch type and that the removal time has arrived. Absorbable threads should not be pulled. Next, position the patient so they won't move and put on gloves. Open sterile scissors and forceps, pour antiseptic into a clean bowl and lay gauze nearby. Once done, clean the wound edge with antiseptic, working outward to inward. This reduces infection risk. Then isolate the first knot with forceps and lift gently. This gives you control for the cut. With the knot lifted, cut the suture near the skin on the side opposite the wound so contaminated thread doesn't enter the incision. Then, using steady, short tugs, pull the free end through the original exit tract. Slow and smooth avoids tearing skin. After each stitch, lay it on gauze and check that the entire suture is removed intact. Make sure to maintain good lighting and a calm pace. If resistance is felt, stop and reassess rather than forcing the suture. Once all stitches are out, clean the site with antiseptic again, pat dry, apply antibiotic ointment if appropriate, and cover with a sterile dressing. Then instruct the patient about keeping the area dry for 24-48 hours and signs of infection to watch for. If you encounter resistance, unexpected pain, redness, or a ruptured suture, stop and consult a clinician. Forcing can cause tissue damage. Finally, record the date, number of sutures removed, and any immediate observation.
Thanks for watching. Consider subscribing if we helped you.